Question 1. A patient with chronic sinusitis reports persistent headaches and facial pain. Which symptom requires immediate follow-up? A. Thick nasal discharge. B. Periorbital swelling. C. Postnasal drip. D. Congestion lasting over 10 days. Answer: B. Periorbital swelling. Question 2. A nurse is delegating care for a patient with chronic sinusitis. Which task is appropriate to assign to a UAP? A. Instructing on saline nasal irrigation. B. Monitoring for vision changes. C. Assisting with facial steam therapy. D. Evaluating medication side effects. Answer: C. Assisting with facial steam therapy. Question 3. Which intervention should the nurse prioritize when caring for a patient with chronic sinusitis and a history of asthma? A. Encourage use of decongestant spray. B. Monitor for increased wheezing. C. Recommend warm compresses. D. Provide high-flow oxygen. Answer: B. Monitor for increased wheezing. Question 4. Which patient condition most likely contributes to the development of chronic sinusitis? A. History of seasonal allergies. B. Mild hypertension. C. Controlled type 2 diabetes. D. High BMI. Answer: A. History of seasonal allergies. Question 5. The nurse assesses a patient with chronic sinusitis who reports blurred vision. What is the best nursing action? A. Administer prescribed nasal corticosteroids. B. Elevate the head of the bed. C. Notify the healthcare provider immediately. D. Provide reassurance. Answer: C. Notify the healthcare provider immediately. Question 6. Which dietary advice should the nurse give to a patient with chronic sinusitis to help manage symptoms? A. Avoid dairy to reduce mucus. B. Increase caffeine intake. C. Consume spicy foods daily. D. Eliminate all gluten. Answer: A. Avoid dairy to reduce mucus. Question 7. When assessing a patient with chronic sinusitis, which symptom suggests a complication? A. Loss of smell. B. Green nasal discharge. C. Nuchal rigidity. D. Nasal congestion. Answer: C. Nuchal rigidity. Question 8. Which instruction is most appropriate to provide a patient prescribed nasal corticosteroids? A. Use after saline irrigation. B. Blow nose immediately after use. C. Shake bottle only once. D. Tilt head backward when spraying. Answer: A. Use after saline irrigation. Question 9. A nurse is prioritizing care for 4 patients with chronic sinusitis. Which patient should be seen first? A. Reports low-grade fever and congestion. B. Has facial pain unrelieved by analgesics. C. Complains of dry mouth from antihistamines. D. Experiences mild dizziness after decongestant. Answer: B. Has facial pain unrelieved by analgesics. Question 10. What is the most appropriate teaching for a patient with chronic sinusitis using a neti pot? A. Use tap water at room temperature. B. Clean device with mild soap weekly. C. Use sterile or boiled water. D. Use before bedtime only. Answer: C. Use sterile or boiled water. Question 11. Which task related to chronic sinusitis care should the RN not delegate to the LPN? A. Administering nasal corticosteroids. B. Assessing for sinus tenderness. C. Monitoring for medication side effects. D. Reinforcing teaching on steam therapy. Answer: B. Assessing for sinus tenderness. Question 12. A patient with chronic sinusitis is prescribed amoxicillin. Which statement indicates a need for further teaching? A. I'll finish all the antibiotics even if I feel better. B. I'll take this with food if it upsets my stomach. C. I'll stop the medicine if the nasal discharge clears up. D. I will report a rash or itching to my provider. Answer: C. I'll stop the medicine if the nasal discharge clears up. Question 13. A patient with chronic sinusitis is preparing for sinus surgery. What is the nurse's priority preoperative action? A. Educate about saline irrigation. B. Assess for recent use of anticoagulants. C. Encourage fluid intake. D. Review past allergy history. Answer: B. Assess for recent use of anticoagulants. Question 14. A patient presents with chronic sinusitis and is being discharged. Which statement by the patient indicates effective education? A. I'll avoid using humidifiers. B. I can stop the nasal spray when I feel better. C. I should avoid flying during flare-ups. D. I'll use antibiotics for prevention. Answer: C. I should avoid flying during flare-ups. Question 15. A nurse receives a call from a chronic sinusitis patient reporting high fever and confusion. What is the priority nursing action? A. Recommend increasing fluid intake. B. Suggest an over-the-counter decongestant. C. Advise an urgent evaluation. D. Encourage use of nasal spray. Answer: C. Advise an urgent evaluation. Question 16. Which factor in a patient's history increases risk for developing chronic sinusitis? A. Routine use of nasal saline. B. Frequent upper respiratory infections. C. High fluid intake. D. Regular aerobic exercise. Answer: B. Frequent upper respiratory infections. Question 17. A chronic sinusitis patient asks about reducing recurrence. What is the nurse's best response? A. Avoid all dairy and gluten products. B. Use antibiotics at the first sign of a cold. C. Practice good hand hygiene and nasal care. D. Take decongestants daily as a preventive. Answer: C. Practice good hand hygiene and nasal care. Question 18. Which patient would be the highest priority for the nurse to assess immediately? A. Sinus pressure and nasal congestion. B. Double vision and severe headache. C. Fatigue and facial tightness. D. Tooth pain and postnasal drip. Answer: B. Double vision and severe headache. Question 19. Which of the following tasks can the RN safely delegate to an experienced UAP for a patient with chronic sinusitis? A. Instructing on medication use. B. Monitoring for complications. C. Reporting worsening symptoms. D. Assisting with warm compress application. Answer: D. Assisting with warm compress application. Question 20. What is the most appropriate discharge instruction for a patient with chronic sinusitis using antihistamines? A. Take them only on an empty stomach. B. Report drowsiness to your provider. C. Avoid driving or operating machinery. D. Stop immediately if symptoms worsen. Answer: C. Avoid driving or operating machinery. Question 21. A patient with chronic sinusitis is prescribed intranasal fluticasone. What instruction should the nurse provide? A. Blow your nose immediately after use. B. Use the spray while lying flat. C. Point the spray away from the nasal septum. D. Use the spray only when symptoms appear. Answer: C. Point the spray away from the nasal septum. Question 22. Which complication should the nurse monitor for in a patient with chronic sinusitis and recent orbital pain? A. Otitis media. B. Orbital cellulitis. C. Deviated septum. D. Dental abscess. Answer: B. Orbital cellulitis. Question 23. A nurse is preparing a discharge plan for a patient with chronic sinusitis. Which intervention supports long-term management? A. Encourage daily nasal saline irrigation. B. Recommend high-dose decongestants. C. Limit all physical activity. D. Avoid all forms of dairy. Answer. A. Encourage daily nasal saline irrigation. Question 24. A patient with chronic sinusitis asks why antibiotics aren't always prescribed. What is the nurse's best response? A. Antibiotics are used only when symptoms are severe. B. Viral infections don't respond to antibiotics. C. You need to request antibiotics from your provider. D. Antibiotics prevent recurrence in all cases. Answer. B. Viral infections don't respond to antibiotics. Question 25. Which task related to chronic sinusitis care is appropriate for an LPN? A. Performing initial sinus assessment. B. Teaching post-discharge care. C. Administering prescribed intranasal medications. D. Creating a plan of care. Answer. C. Administering prescribed intranasal medications. Question 26. What is a red flag symptom in a patient with chronic sinusitis that requires immediate provider notification? A. Dry mouth. B. Persistent cough. C. High fever and photophobia. D. Loss of appetite. Answer. C. High fever and photophobia. Question 27. Which factor is most important when evaluating treatment effectiveness for chronic sinusitis? A. Increase in body temperature. B. Resolution of sinus pressure and drainage. C. Return of appetite. D. Normal respiratory rate. Answer. B. Resolution of sinus pressure and drainage. Question 28. The nurse suspects that a patient with chronic sinusitis may be experiencing a fungal infection. What finding supports this? A. Clear nasal discharge. B. Non-responsiveness to antibiotics. C. Intermittent headaches. D. Improved symptoms with antihistamines. Answer. B. Non-responsiveness to antibiotics. Question 29. Which self-care practice should the nurse discourage in a patient with chronic sinusitis? A. Using over-the-counter antihistamines. B. Performing daily nasal irrigation. C. Using cold compresses on the face. D. Smoking cigarettes. Answer. D. Smoking cigarettes. Question 30. A patient is scheduled for endoscopic sinus surgery. What should the nurse emphasize in preoperative teaching? A. Take aspirin 24 hours before surgery. B. Expect significant bleeding post-op. C. Avoid nose blowing for 7 to 10 days. D. Use nasal sprays immediately after surgery. Answer. C. Avoid nose blowing for 7 to 10 days. Question 31. A patient reports chronic sinus congestion with a foul-smelling discharge. What does this most likely indicate? A. Dehydration. B. Nasal polyps. C. Secondary bacterial infection. D. Allergy flare-up. Answer. C. Secondary bacterial infection. Question 32. The nurse is assessing a patient with chronic sinusitis. Which finding would be most concerning? A. Reports of fatigue. B. Double vision and swelling around the eye. C. Nasal congestion lasting 14 days. D. Yellow nasal discharge. Answer. B. Double vision and swelling around the eye. Question 33. A patient with chronic sinusitis is prescribed a mucolytic. What is the expected outcome of this medication? A. Reduce inflammation. B. Improve mucus drainage. C. Kill bacterial organisms. D. Decrease blood flow to sinuses. Answer. B. Improve mucus drainage. Question 34. Which teaching is a priority for a patient using oxymetazoline nasal spray? A. Use it for no more than 3 days. B. It's safe to use daily for chronic congestion. C. Use with a neti pot immediately after. D. It works best if used with oral antibiotics. Answer: A. Use it for no more than 3 days. Question 35. A patient with chronic sinusitis reports worsening symptoms after starting decongestants. What should the nurse suspect? A. Drug resistance. B. Allergic reaction. C. Rebound congestion. D. Poor medication compliance. Answer: C. Rebound congestion. Question 36. A nurse provides education to a group of patients with chronic sinusitis. Which statement requires correction? A. I can reduce exposure to allergens to help prevent flare-ups. B. Daily hydration will help thin secretions. C. I'll stop saline irrigation if I feel better. D. I'll sleep with the head of my bed elevated. Answer: C. I'll stop saline irrigation if I feel better. Question 37. Which assessment finding is most consistent with chronic sinusitis rather than acute sinusitis? A. Facial pain lasting over 12 weeks. B. Sudden onset of high fever. C. Toothache and ear pain for 3 days. D. Purulent nasal drainage for 5 days. Answer: A. Facial pain lasting over 12 weeks. Question 38. The nurse is teaching a patient about using warm compresses for chronic sinusitis. What should the nurse include? A. Apply to the back of the neck. B. Use for 5 to 10 minutes several times a day. C. Only apply if discharge is green. D. Avoid if taking antihistamines. Answer: B. Use for 5 to 10 minutes several times a day. Question 39. A patient with chronic sinusitis reports increased sinus pressure when bending forward. What should the nurse assess next? A. Medication compliance. B. Presence of sinus tenderness. C. Sleep pattern. D. Respiratory rate. Answer: B. Presence of sinus tenderness. Question 40. Which symptom would prompt the nurse to suspect that a chronic sinusitis patient may have developed meningitis? A. Loss of smell. B. Persistent sinus drainage. C. Neck stiffness and photophobia. D. Facial tenderness on palpation. Answer: C. Neck stiffness and photophobia. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!